All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, your community pharmacist. We're going to get right back into your calls, and we're going to go with AJ. Welcome to Pharmacist on Call. May we help you?
Hey, how's it going, man?
Pretty good. How are you?
I'm doing great. First of all, I want to thank you because a couple summers ago, I had an issue where I had a ulcer in the bottom of my foot. I couldn't heal it, but I did know about Kangen water for very many years. And I remember that if you get the acid water and you soak your foot in it, the acid water is, well, hell, we're made of water. So, you know, it can't hurt you, but it will kill the pathogens and stuff. And I still have my foot, so thanks for that.
Okay, yeah.
I was one of the first people that I could ever get a hold to that water. So, and I want people to know that it has so many different uses. They need to understand what it's for, and they need to understand that water is what we are, and carbon.
Yes, we are.
And stuff. So, but thank you for that. And I'll need to know I got CBD Ultra Oil.
Okay.
How do I start the dosage on that?
What's the milligram on it?
It's 100 milligrams.
100 milligrams. I would probably, what size bottle?
That's what I'm saying. Hold on, let me look at it. It is 100 milligram bottle.
So is it a small bottle or the 30 ml bottle?
It's the small bottle.
Then I would do about 5 to 10 drops up under your tongue. Let it sit there for a minute or so.
Okay.
Actually, just start out with 10. Let it sit up under your tongue, and from there it's going to go into your bloodstream rather quickly. And then you just swallow the rest. You should feel the magic happen, shortly.
Right on. Okay. All right, man. Thank you very much.
Yes, sir.
Keep doing what you do, man, because, pharma don't care about it.
No, but I do.
Amen.
Yes, sir. All right, thank you, and I appreciate that. AJ brings up a very good point. The water has a multiplicity of uses. So the acidic water, great for bacteria and pathogens. The super alkaline water for soaking your vegetables. Beauty water for skin and hair. But we're going to jump into some of these other calls here. Ava, welcome to Pharmacist on Call. May we help you? Hello, Ava. Going once, going twice.
Hello.
How may I help you?
Yes, I was calling to see what would you recommend supplement for a senior parent that's been diagnosed with stage 3 kidney disease?
Stage 3 kidney disease. I say start them on the alkaline water, which is going to replace whatever they're drinking now.
She's just drinking just regular water.
Okay, let's get her on alkaline water so we can, tax her kidneys less. And then the other thing is burdock root seems to work really well in my patients with kidney disease.
Okay. Now, does the alkaline, because it seemed like I read that alkaline, I guess because, she has to now monitor her phosphorus intake and potassium intake. Does the alkaline, would that, kind of further damage her kidneys, or because right now we're just trying to, maintain it and strengthen them if we can?
No, ma'am. No extra potassium.
Okay. Okay. What about phosphorus?
Phosphorus. I can't think of any phosphates being present in there.
Okay.
Yeah, it's water.
Okay.
H2O. Yeah,
I'm sorry?
It's H2O. Yeah, there's no phosphorus compounds in there. But you want the cleanest water you can, because part of the kidney's function is to filter all the gunk out. So the cleaner the water is, the less work her kidney has to do.
Okay. Okay, so you recommend alkaline water, right? And you guys make your own?
We do, yes ma'am. We have 2 machines and about to get a 3rd one where we process the water. But burdock root also, and she can get it in tea form if she likes tea, or capsules.
Tea form or capsules, okay. All right, and do you guys carry the burdock root as well?
Yes ma'am. Yeah, I just got a shipment in 2 days ago.
Okay. And one more question, Dr. Pruitt. What do you recommend as far as strengthening, I guess, the brain in terms of like, cognitive impairment?
There is a product, and I haven't really vetted it Prevagen, I believe, is what it is. But I've had one patient try it, and you know, she swears by it. But I usually recommend ginkgo biloba because what it does, it increases the blood flow in the brain.
Okay.
So I recommend ginkgo biloba. But Prevagen.
But does the ginkgo, it doesn't increase blood pressure, does it?
No, ma'am. Actually, it would decrease the blood pressure because as you open up the vessels, that's less pressure the body exerts against that.
Okay. Okay. So ginkgo. Okay. All right.
Ginkgo biloba.
Ginkgo biloba. Okay. Great. Thank you so much.
Yes, ma'am. You're welcome.
Bye.
All righty. Bye bye. Let's see. Thelma, welcome to Pharmacist on Call. How may we help you?
Hello?
How you doing?
Hello, Dr. Pruitt. This is Thelma, as you know.
Yes, ma'am. How you doing?
Well, pretty good. Really enjoying all this great information that your public is sharing with you. I wanted to ask you about turmeric and if there's any possibility of like taking too much of it. Is it better to take the capsules or is there any
or the powder form?
If you could take it loose, yeah.
I think either way is fine. I prefer the capsules because that way I know what dose I'm getting. So when you're trying to sprinkle it over your food with a spoon, the dosing can be inconsistent. You may be giving yourself too much, or you may be giving yourself too little. Can you OD? Can you take too much? Yeah, I would imagine like anything else, you probably could, but it may be a little tough to do. I know
not with the 800 milligram capsules. If you just take 1 or 2 of those a day.
Yeah, and I've taken up to 3 if I'm getting ready to work out, just because I really want to be, no inflammation while I'm working out. So yeah, I would say 1, 2, 3 is fine.
Okay, and that's before you do any exertions.
Yeah, and then sometimes I take it before I lay down because, depending on how you sleep, you may sleep funny and your back is hurting when you wake up. So I just prefer to also take it. I take it twice a day.
Like a Charlotte horse in the neck, and that would help if you sleep funny. Okay. Well, I appreciate that very much. And also, could you tell me what are you talking about? Are you on again on Sundays?
No. So I'm going to do another show 2 weeks from today because I did not do a March show.
I see.
So I got to make it up to the viewers. So, yeah. So we're going to do 2 for the month of April.
Okay, 2 for April. Well, that wouldn't be Easter Sunday, would it?
No, that would be Thursday.
That Thursday before Easter Sunday.
I'm not even sure when Easter is, but yeah, it's the 18th.
I'm looking at it. It's the 21st.
Okay, so then that would be Good Thursday.
The 18th. Okay.
Yes, ma'am.
All right. Well, let me get back to enjoying the show. Thank you for the information, and I've got the 800 milligram capsules, so I'll just keep those.
Yes, ma'am.
And not try the loose form yet.
Yeah. Just 1 or 2 a day should do you.
All right. Well, and also that cream, the CBD cream.
Yes, ma'am.
Does that act in any way to like push heavy metals or anything out of the body, or is it just for pain control?
Well, no, it's just for any type of skin irritation. So a lot of people use it also for eczema or different types of rashes or skin infections. So I don't think it may. But as far as what I know, no, it doesn't push any toxins or heavy metals out, not to my knowledge.
And how much is the cream, Dr. Pruitt?
The cream, and I didn't even bring it, it's $39.99. It's a tube about that size.
What's that in that pink box?
This?
The pink box, what is that?
This?
Yeah, the tall pink box.
This is a petamine. This is a weight gaining supplement. So for those, people who want to pick up weight, get thick. Yeah.
Well, okay, my granddaughter Chelsea may want that, but no, I was thinking that pink was the cream.
Yes,
okay, it's $39.95 for the cream, and that's what, about a 30-day supply, or?
Probably about 2 weeks, depending on how you take it,
Depending on how often you use it. All right, well, thank you much, Dr. Pruitt, and you have a great rest of the night. I'm going to enjoy the show.
Okay, all right, thank you.
All right, bye-bye.
All right, bye-bye. For those who don't know, that's my mother, a frequent caller into the show. All right, so we've got Eugene. Welcome to Pharmacist on Call. May we help you? Hello, Eugene. Eugene. Turn your TV down there, brother.
Yeah, hey, I got a question to ask you. I had a physical about like a week. Pardon?
Go ahead.
Yeah, I had a physical about like a week ago. Everything checked out all right, but he said my cholesterol was a little high to kind of watch my diet.
Mm-hmm.
I just wonder if it's something that I should, because I don't eat right no way, but is it something that I just can take like once a day, for my cholesterol?
Absolutely. There are a couple of things, 3 things you can take. The first is red yeast rice. And what it does, it actually acts like a cholesterol medication. The liver converts it into, I believe, Mevacor, which is lovastatin. The second thing you can use is the beetroot juice here. This also reduces your cholesterol too, and man, high in fiber, so will help clean all that stuff out. And then the third thing that you could use is Garcinia cambogia, which is our weight loss supplement. This also blocks the body from making fat at night, and so it also decreases your cholesterol. But to you, I would say probably just modifying your diet would nullify you even having to take these, and maybe just designate a cheat day or 2 during the week where you really go, hard on the butter and the cheese and all that, and the fried foods.
Well, could I take that beetroot juice, like just take it, maybe like...
You would do a capful a day.
Every day?
Yes, sir.
You think that'd be better?
It'd probably be the easier of these for you to do. Yeah, so you may even, depending on where your numbers are, you may even want to do it twice a day.
All right.
Mm-hmm.
All right.
Yep, so yeah, the beetroot juice is a good option for you. $17.99, little capful, lasts you about a couple of weeks. But diet, again, that's what we want to do, is modify the diet, not change it totally, but just for the majority of the week, probably avoid the fried food, bake your chicken instead, bake your fish instead, and certainly the butter and cheese, kind of limiting that too.
All right.
Mm-hmm.
All right, thank you.
Yes, sir, thank you. All right, everyone, stay right there. We got more calls coming up. We're on a break.